Well, let's focus on the coronavirus crisis in the national capital. In Delhi, recorded 6,396 new COVID cases and 99 deaths in 24 hours. A sharp spike in cases. On Monday, Delhi had recorded 3,797 cases. Now, the Delhi Chief Minister Arvind Kejriwal on Tuesday said that his government has sought the centre's go-ahead to allow to shut some markets for a few days. The state is also looking at reducing the number of people allowed for weddings back to 50.
Of Delhi's major government hospitals, lengthy queues. At a COVID help desk, barely a fortnight ago, this was largely empty.
We are getting most of the cases actually, and most of them are very sick patients because they are being refused by various hospitals, including some private hospitals. I can tell you that number of patients has increased, so number of ambulances coming to the hospital definitely increased.
While the government has ruled out a lockdown, Delhi Chief Minister wants to reimpose restrictions, which has to be cleared by the centre.
सारी कोशिशों के बावजूद भी अगर किसी बाजार में हम देखते हैं कि सोशल डिस्टेंसिंग और मास्क का पालन नहीं किया जा रहा और वो एरिया एक तरह से लोकल कोरोना हॉटस्पॉट बन सकता है, तो उस वहाँ पे बाजार को कुछ दिनों के लिए एहतियात के तौर पे बंद करने की इजाज़त दिल्ली सरकार को दी जाए.
Doctors welcome any restriction to cut down on crowds, and the centre says the brunt of the festival crowds is yet to come. The low number of new cases in the last 2 days could be an aberration.
पिछले 48 घंटे में केसेस की नंबर कम हुई है, लेकिन इससे अभी हम कोई अर्थ नहीं लगाएंगे. परिणाम अभी हम इस सप्ताह में और अगले सप्ताह में देखेंगे.
80 to 90% of our beds are occupied, particularly the ICU beds.
Markets, however, are anxious about being shut down.
हम लोग तो खुद भूखे प्यासे थे 1 महीना तक. उसके बाद रिक्शे चलाने का मौका मिल रहा है चांदनी चौक पे.
भीड़ देखते हुए डर नहीं लगता आपको?
नहीं, हमको डर ऊपर वाले से डर लगता है भाई. नीचे वाले क्या कोरोना
ज़्यादा जरूरी है.
हाँ भाई, ज़्यादा जरूरी रोटी वोटी है.
What the Prime Minister says, जान है जहान है. I would add, जान बची सो लाखों पाए. If you save your life, then you can earn. If you don't save your life, then you're gone.
Looking at all the crowd around me, one can assume that the COVID-19 situation is completely under control in the national capital. However, it's not. And with just 8% of ICU beds with ventilators vacant across the city, the situation is more critical than ever. And it is not going to get better until and unless people start taking their responsibilities more seriously. In New Delhi, with camera person Mohammed Kaif, I'm Akshay Dongre for NDTV.
Well, let's go across to Arun for more details. And Arun, the cases in Delhi have increased, gone over 6,000. So that's a big spike after 2 days of being under 4,000. Also now Noida has raised the alert and they've started checking commuters coming in from Delhi.
So senior health officials had a meeting with District Magistrate of Gautam Budh Nagar, and they have come to this decision that they will be conducting random testing at DND and also another area, Chilla. And these two facilities will be randomly testing commuters. Now, they are also linking it to the rise in number of commuters on Delhi-Noida-Delhi Expressway, and that can be directly linked to the festive season. We also saw markets flooded. Gargi, we've been reporting from different markets, and Arvind Kejriwal, Delhi CM, also pointed out that because of festivities, people came out, and that has also led to this increase. Now, the number, the latest that we have is above 6,300, which is not very far from a record-breaking number that Delhi showed few days back, which was above 7,000. Now, this increase is definitely worrying if you see it with the availability of ICU beds in Delhi hospitals. So overall, Delhi CM is also taking some decisions. He has proposed shutdown of markets which have come out as hotspots. On the other hand, if you talk about Delhi NCR, we have this decision coming from Noida administration, for Gautam Budh Nagar administration, that they are conducting random testing, Gargi.
All right, Arun, thanks so much for joining us with those details.